It started in 1966 when I, through anti-Vietnam War activities, met Carl Sagan. Do people here recognize the name Carl Sagan? Well, I didn't know whether you're all a lot younger. Well, Carl and I ultimately became the closest friends. And Stu and so we were quite close. But at this time, we had just met this Vietnam War thing, and then socially, for the first time, I saw anybody smoking marijuana. I couldn't believe it. I said, Carl, you're smoking marijuana? He said, yes. And I said, don't you know that's very dangerous? You know, as a young, arrogant physician, I knew everything about drugs, and I knew how harmful marijuana was. And I would say, you shouldn't do that. It's very harmful. Here we go. Here, let's have a puff. It's harmful. And I continued to be distressed about that. And then as our social lives merged, and I met more and more of his friends who were not unsophisticated people, and they all smoked dope. And I thought, wow, how is this? You know, and I started to ask myself, how did I become such an expert on marijuana like everybody else in the country, knowing that it's a very harmful drug? And I went into the Countway Library, the library at Harvard Medical School, and started to review the literature. And I had my first epiphany in the Countway Library. I had to wrap my arms around the fact that this was, contrary to my hitherto beliefs, a remarkably non-toxic drug. And that the greatest harm from marijuana was not any inherent psychopharmacological property of the drug, but rather the way we as a society were treating this drug. In 1966, 67, in the United States, 300,000 people had been arrested for marijuana charges. I then, I'd gone into the library with the idea, well, now that I realize this, I'd gone into the library in the first place to write a short paper which would be accessible to young people so they would learn how dangerous this was. And of course, that was not what I was doing now. So I ended up by writing an 80-page paper, which was published in a journal very popular with young people, the International Journal of Psychiatry. And I think 3 people read it. And one of them was the editor of Scientific American, and he called me. He was quite excited about it. He said, look, if you would reduce that to a size that will fit into Scientific American, I will publish it as the lead article. And that happened, and I think it was, that was in about 1968. And while not surprisingly, the article of the International Journal of Psychiatry didn't create anything, the reaction to the article in Scientific American was huge. My wife and I, listening to 11 o'clock news that night, heard about Harvard professor, who was really instructive, says that marijuana is not harmful. Wow. Well, within a week or two, there were 3 publishers who called, and they wanted to come over and see me about writing a book. I had just published or was just working on a schizophrenia. Was just about done. I was waiting for one of my junior authors to get his chapter in. And I had other plans, but they were very convincing. He said that it was Murray Chastain, the deputy director of the place. He said, look, you've already written an 80-page paper, and if you just sort of triple that, we can make it look like a book. So I said, hey, it would be nice to have a book on this subject. I was fascinated by it, and I felt it sure needed a thorough review. And I was also moved by the fact that my son, Danny, who at that time was 10 years old, his only interest, the only interest he showed in any of my work was marijuana. He was interested in marijuana. And that very year, he developed acute lymphoblastic leukemia. So that was another reason to do this. So I reached an agreement with Harvard University Press. I wanted to be sure that book was published in time. So we agreed that if I collapsed the time to turn a manuscript into them, they would accelerate the publication time. And indeed, on March 24th, 1971, I had a copy of his name. Now, this book was, it reviewed the front page. It was reviewed the front page of the Sunday Times, the best dope on pot so far, and it was widely reviewed in both lay and scientific medical journals, and almost all of the reviews were. It was a rare review, it wasn't quite positive. In 1970, I should say another event here was, that was in 1971. It led to a lot of invitations. Let me go back a bit. When I was writing the book, I did every aspect of the thing I could get. Kept the history, chemistry, and the literature which provided me and ultimately the reader and mine some idea why do people want to use this as particularly a recreational drug or for any other reason. So I read widely in the French Romantic literary movement, the members of the Babson Cannabis and people like Charles Baudelaire, Theodore Gaudier. But they were very interesting, but they would take large amounts of hashish and eat on the Ile de Paris, and they're really stoned. And then they were their very great capacities for imagination would write the, they were a little bit over the top, I thought. And so I really had to read people, American authors like Bayard Taylor and a few others, including Carl Sagan, who wrote a piece for me called Mr. X. He wrote it for Marijuana Reconsidered, but it was important. Carl was talking before Congress or NASA or what have you all the time. We had to keep his use of it anonymous. But once he passed away in 1996, I revealed that Mr. X was written by Carl Sagan. It's the best. What I did, originally I had hoped to write 3 books. One on recreation, that was Marijuana Reconsidered. I mean, it was written to tell people just how harmful it was or was not. And then in 1993, I wrote Marijuana, the Forbidden Medicine, the book on its use as a medicine. And my third book was going to be, once I had started using it myself, and I decided while I was in the library reading those people, I was going to have this experience. It seemed to me a very interesting, mild alteration of consciousness that I wanted to explore personally. But I also realized that if the book were successful, it might involve me testifying before various congressional committees and courts and so forth. And I anticipated there might be the question, Doctor, have you ever smoked? And I decided I was going to be open about this. I'm not going to deny it. From the time I smoked, I'm going to be open. I was never provocative about it, but if I was asked directly, I would always tell the truth. And after 2 years of doing that, I decided the time had come. I'd paid my dues. Now I could begin to use this. And I've been using it ever since then. And I have to tell you, it went, in my case, from being a kind of scourge that I was telling people about to something I consider one of the blessings in my life. But now I'm getting off the track here. So anyway, and I should mention one other thing. In one of those talk shows, and I was on a talk show, everything from Good Morning America, is Barbara Walters. But the one that stands out is Barbara Walters because she had 4 guests. She asked the question, I'm going to ask each of you if you have smoked marijuana. She gave us a little warning. And she went to the first one. She happened to be a fellow faculty member at Harvard Medical School. And he said no. And I was surprised because just the weekend before, the party at his house, she had smoked. And that wasn't the only time we smoked. And then they came to someone who also trained at Harvard. He wasn't there now. He became the first, well, I shouldn't even do this because I should protect his identity, but what the hell. He was the first drug czar for the United States. And as you know, tradition of drug czars, very negative. And when he was training with me, and he knew I was doing this, he wanted to ask me some questions. And in the course of that discussion, he revealed to me that he smoked marijuana and he thought it was very nice. And it comes to him and he says, no. And then I can't remember even who the third fellow was, but he said no too. And she comes to me and she said, and Dr. Grinspoon, have you ever smoked marijuana? And I said, not only do I smoke marijuana, she said, have you ever smoked marijuana? I said, no, have I smoked marijuana? But I do smoke marijuana. And Barbara Walters' jaw dropped. As I imagine a lot of other people who were watching that show. Well, that was 1973. In 1975, I don't think that clock is right, so I don't want to go over my time.
No, keep going.
You give me a signal on it.
Yep.
In 1975, my chief put me up for early promotion to professor. And I surely went about rewriting my CV as it had to be written for the promotions committee before happily anticipating that event. And then about a month and a half later, his secretary called me down to his office, and I could tell by his greeting that something was wrong there. And he said, "They turned you down." I said, "They turned me down?" "Yes, they turned me down." "Can you tell me why?" "Well, they loved your work, your other work, and your book on schizophrenia they really liked. But they found marijuana Reconsidered too controversial." I said, "Jack, too controversial? What does controversy have to do with it? Aren't we in the academy?" And he goes, "Now listen, I'm just the messenger. Don't listen back." And as I was leaving, he asked me, they asked me to ask you what you were going to be doing in the future. And I don't know why I rapidly made this reply. Perhaps it was, came out of my disappointment, alloyed with anger, but whatever. I said, "I'm an intellectual will of the wisp, and I can't tell you," which wasn't altogether true, because at that time I was finishing the book on amphetamines, which was also published by Harvard University Press the next year, and played a key part in motivating Senator Gaylord Nelson to hold amphetamine hearings. And those hearings resulted in this country coming with kind of legislation that was necessary to get doctors to stop prescribing it for weight and all sorts of things, and to take a more reasoned attitude toward it. Anyway, I'll skip ahead.
10 to 15 minutes.
Pardon?
10 to 15 minutes.
To go or?
Yeah, to go.
Oh, okay. And where was I?
We're going to jump ahead. Look at the amphetamine book.
Oh, with the amphetamine book, yeah, Gaylord Nelson, Senator Gaylord Nelson held hearings on this, and I mentioned that was really instrumental in this. And I had decided that I don't feel an obligation to go to all the faculty meetings now. I was free, and I was going to enjoy that freedom. And people wonder how I had all the time to do, the stuff that I've done. And the answer was simple. I cut out faculty meetings and boy, and I really came to terms with that because, I figured, hey, that's the price. The other thing is, they didn't say it, or at least Jack Ewald, when he said, a controversy, but it also occurred to me that I couldn't help it. I became an activist. Academia, activist is a bad word. He can always right to it. But, Carl Sagan was paid the price for being an activist, but we have all profited from it. In fact, I not only miss him personally, but it seems to me if there's one person who might be able to arouse the American people about the threat of climate change, he would be the person who would be most likely to have it then. I was really kind of isolated, became sort of isolated from the faculty. And I didn't hear much from Harvard Medical School. I'm going to collapse this a bit. It's beginning to sound so whiny. I really didn't hear from, when I left the school, I should tell you about another thing. That in 1995, I announced that I was going to become Emeritus in 2000. And I don't know how much this had to do with it, but within some months of that, I heard by the grapevine that the promotions committee has reopened after more than 20 years their decision to deny me a full professorship. And it wasn't just a few weeks later that I heard from my new chief that they had acted positively on it. All it needed was his signature and the signature of another man who was the super chief, the Harvard Department of Psychiatry. The Harvard Department of Psychiatry is comprised of 7 little fiefdoms. You know, I was at the Mass Mental Health Center, but there was a Department of Psychiatry at the Brigham, at the Beth Israel, at the McLean, at the Cambridge, and so forth. And the Harvard administration was concerned that this was too disorganized, and I would bring in somebody who would be the super chief of all these things. They brought in a fellow from Joe Gore from Johns Hopkins. And I knew he was going to be a problem. He went to each of these little hospitals, and we were all gathered in the library to be introduced. And when he came to mind, he didn't say anything about anybody else. He came to mind and he said, "Oh yes, I know your name." I don't know whether he said he read or he knew about my book on psychedelic drugs. Actually, it was two of them, and I didn't like it. And I thought, wow, to say this in front of all my fellow faculty members, and I had an ominous sense that I was going to have a problem with him. And over the years, there sure was. Now, as I say, I became emeritus in 2000, and I really didn't hear much from Harvard Medical School, except the usual announcements of speakers and frequent appeals for funds. And then one day, I got, and this was now in 2012, I got an invitation to write a piece for Harvard Medicine, which is the magazine of the journal that goes out to people in the community, the Harvard medical community. And then I learned, well, there was going to be an opposition piece, a piece which would prevent the other side. And I thought, my goodness, that's like, people who talk about evolution, having to have a creationist on the same program, because you had to balance it out. And I thought we had moved, and that used to be the way it was early in the days, but we moved, people with a modern understanding, a data-driven understanding of cannabis. Now, you don't need that. This hadn't happened to me for years. And I wrote the piece, and then at the same time, or almost at the same time, I was invited to give a talk at a well-known series at Harvard Medical School called Talks at 12. It's held from 12 to 1 in the biggest auditorium at the medical school, because people from all the different 7 places and anybody else connected with Harvard Medical School was invited. And then I learned I didn't have 40 minutes to give a talk, and allowed 15 minutes. It was going to be the opposition, the piece who would, they call it opposition, the other side, or whatever it was. And in fact, it was the same man, a younger man, who runs the rehabilitation center at McLean Hospital. Now, just for a moment, I just want to tell you that McLean Hospital, as you know, it's a very, you have a patient you want to send there, it's got to be a very rich patient. Just very. So, and here's how it goes. His position is that 9% of people who use marijuana get addicted. That comes from the U.S. government, like almost all the misinformation about marijuana. Now, where does that come from? It comes from the fact that nowadays, and this has been going on for a couple of decades now, judges don't want to send these young people to prison. They don't know what to do with them. So now we have many drugs, and they'll get a young person who's been caught with possession or even selling an ounce or what have you. And the judge will say, look, I'm going to give you a punishment, or you can go into therapy or drug rehabilitation place. And what happens is the rich daddies, the rich ones, can afford this. But when they get to the psychiatrist or the drug rehabilitation place, you know, in order to get on the DSM-5 reimbursement, you've got to write down cannabis addiction or cannabis dependence. And then the government uses this to create this 9% data because they have a tax. This is where the 9% largely comes from. Now, there may be some addiction in the sense that there are some people who use it all the time. But, and some of them work very well using it all the time. But some particularly young people, it seems to me, they're not addicted, they just can't figure out what it is they want to do with their lives, and so they sit around. At any rate, so this is the guy who was going to write the opposition piece. And, you know, it's absolutely true that his living comes from the addicted kids who go into his unit at a clinic. At any rate, that was distressing, but the most distressing thing about it, well, first of all, I should tell you, that auditorium was full. There were people sitting in the aisles. And as I looked out, they were like you, they're a younger crowd, you know. And except there were a few people of my generation, two, and they both spoke. One of them got up and told me that he felt that I was doing something harmful to the people, to the young people, because I was reducing their fear of marijuana. And didn't I know that it takes the brain until at least the early 20s to be fully developed. And, you know, and it wasn't a question so much, but I answered. I said, well, if you really knew my work, you would know that I don't advocate its use for people under the age of 21. I dismissed that. But then there was a person, I can name her because she was the deputy director to the drug czar presidential pick in the George W. Bush administration. And she was, you know, in my generation. And she didn't even wait to be called out. She stood up and she started this very extreme criticism of me. And her words were getting so hysterical that I thought surely the chair would say that. Do you have a question? And she just wasn't interrupted. She went off for about 3 or 4 minutes and sat down. And that was really pretty discouraging. But then the most encouraging part of that experience, the first time I had spoken at the Harvard Medical School in decades, was that so many of the people, there were 2 people, she asked us to stay the chair if we would answer, wasn't much time for the question period taken up by these 2. Would we stay and answer questions? And we both agreed. There were 2 people who came up to ask Dr. Bill questions. There was a line that went up the stairway, people who wanted to see him. Now, some of them had questions, but some of them just wanted to say hello and wish me well, what have you. Some of them had, 2 of them had books that they wanted to have autographed. And some of them just wanted to have a friend take a picture with him with his iPhone, take a picture. So it was very clear to me, the young people get it. My generation doesn't. And I think the solution for Harvard Medical School, getting into the modern age with cannabis, is is going to be when all of us die out. Otherwise, I wouldn't give a very optimistic prognosis, but we will. So I think I ought to just stop at that point.